I am Hans John, the 2019 Vinci Ragasoka Muna. I took the COVID-19 vaccine and so should you. Let's be an example to others. Get vaccinated today and help control the spread of COVID-19.
Vaccinate if you want to eliminate the spread of the virus in our place, and do not procrastinate, but rather let us vaccinate. Get vaccinated today.
Good evening and welcome to this week's edition of Round Table Talk. This week we are pleased to welcome Dr. Gerald Thompson, who is an infectious diseases specialist, and he's also an advisor to the St. Vincent and the Grenadines COVID-19 task force and has been very active in the work relative to COVID-19 as well as other infectious diseases here in St. Vincent and the Grenadines. Today, we want to talk a little bit about COVID-19, of course. There's a new variant that's causing some concern throughout the world. We want to talk also a little bit about AIDS, because today, as you know, is World AIDS Day, being observed around the world every December 1st. So I think that we should be observing World AIDS Day in St. Vincent and the Grenadines. We'll talk a little bit about that. We'd also talk about dengue, which seems to be continually causing more concern on the island. And we'll also talk a little bit also about hand, foot, and mouth disease, which within recent times has also become an issue of concern. Dr. Thompson, welcome again. You have not been here with us for quite a while. It's good to have you as usual. We are going to start out, of course, talking about the new variant, COVID-19 variant, which also has some variants in the actual pronunciation as well. It's Omicron is whatever it is, but the fact is, it's a new variant. It's here with us. What should St. Vincent and the Grenadines, what should Vincentians know about this new variant?
Well, thank you very much, Teresa, and all you listeners. Are you hearing me loud and clear?
Loud and clear.
This new variant has a name, Omicron. Really, some people may want to pronounce it Omicron, but the I seems to be silent, so it's Omicron. And the World Health Organization decided they were going to start to label any new important variants using the Greek alphabet rather than using the country that they may have originated from. And you may recall the alpha, the first letter of the alphabet, came from the British Kent strain. Then the beta was the dreaded South African strain. And then the gamma was the Brazilian. You'd have heard us talk about these things. Well, in the meantime, there have been many others, the lambda, the T, all of which caused a stir. More recently, they had the mu, right? And we had the mu detected here in St. Vincent and the Grenadines, but what has caused more of the spike here in St. Vincent has been the Brazilian gamma and the delta. Now, what the next name was supposed to be was new, but they couldn't call it a new variant. New is a letter in the Greek alphabet, so they couldn't call it new. And they couldn't call it Z, which is the first name of the president of China. And so they had to skip those, and so they've arrived at Omicron, just as a little background. Now, Omicron being the 15th letter of the alphabet, no significance to that at all. But this has been detected in Southern Africa, again, not necessarily just South Africa, but the most cases, 77 cases already in South Africa, but Botswana, Mozambique, and so And it is now spread to over 22 countries, with England even having 23 cases, and the Netherlands 14, and Canada 6. There's no new cases in the United States. But what's significant is several things. 70 countries of the world have put restrictions on flights out of Southern Africa and all those states in Southern Africa. St. Vincent the Grenadines would have done likewise. And in addition, we would have had an extremely high risk category, which included these countries from South Africa, but also included Israel, included Hong Kong, and included Italy. It has not as yet included the UK and that of Canada, but things I'm sure are being closely monitored. What we're finding with this new strain is that it seems to be highly transmissible. Why? On the surface of the virus, there are these spike proteins. Dig a little science into this. There are 26 spike proteins on the surface of every one of these viruses. And they use this spike protein to stick to the back of your throat and your nose to get in. They use it like a lock and key. That's how it gets into your body. And this virus, this variant, those spike proteins seem to be stickier. And so therefore it can cause more readily increased transmission. But in addition, we are always worried to see if it is causing more severe illness, more hospitalization, more people admission to the intensive care. It doesn't seem to be doing that. It seems to be just causing chronic, well, a fatigue, headache, maybe a scratchy throat, not even a sore throat. This is unlike the Delta, which caused loss of taste and loss of smell and a lot of respiratory symptoms. But the big issue is, does this variant evade the immune system? Does it evade the strength and the effectiveness of vaccine? So far, it does not seem to be doing that, but it will take another week plus for us to find out more definitively if this variant is one that has legs to do some major damage around the world. It is a variant of concern, and so far, it does not seem to be a variant that has evaded the immune system and vaccines, but we still have to find out if that is the case.
Okay, I think I read a couple hours ago that in fact the United States has found a case, someone in California who actually came into the country from South Africa on November 22nd. So they have in fact isolated that particular case.
Well, I'm glad for that. I've been monitoring that most of the day and so forth, and had not really seen anything on nature. But Southern Africa is very interesting. And I want to say, it will go on in a while, that this is World AIDS Day, but variants emerge because inside a person's body, when a virus gets in, the virus starts to produce millions and millions of copies of the virus. But it makes a lot of mistakes. Most of the mistakes it makes, those viruses, those variants that it makes as mistakes, they die quickly. But every now and again, it produces a mistake that is stronger than the virus that is infecting the person. And these mutations take place inside a person's body who is usually immunocompromised, whose immune system isn't fighting the virus in any major way. So what happens? The virus has room to play. When the cat's away, the mice will play. And the virus that now is a variant that has greater strength, it starts to multiply. A patient may be admitted to the hospital with one variant, and they may stay in the hospital for 60 days. When they leave the hospital, unfortunately, a different variant may be coming out of that person's body. And if it's one that can be transmitted very quickly, high transmissibility, it will spread quickly, and so that's what's been happening with the Delta. Now, sadly, South Africa has one of the highest HIV/AIDS concentration incidents in the world. 19%. Would I say 1 in every 5 adults between the age of 18 and 65 may be infected? I hate those figures because they're not believable. But several African countries in Southern Africa belong into that category. And I must say, the Caribbean is quite a way behind, but we do have our incident too. And so twinning together the whole concept of COVID and HIV, there are other conditions such as chronic diabetes, arthritis, renal failure, cancer, chemotherapy, in which patients who are infected, mutants can develop. But usually what I'm saying is that these mutants die off very quickly. It's on those rare occasions that a mutant of greater strength, greater transmissibility develops and has legs to start to travel around the world.
In terms of treatment protocols and in terms of our preparation for the possibility of the new variant entering our country, what are some of the things that have been put in place as far as the Ministry of Health and the task force are concerned?
Well, you know, they're really continuing with what they have been pushing, because it seems that the vaccines are still very effective against these variants. And let me pause here to say, we were concerned about the Delta variant, and we were worried that the Delta variant may not be able to stand up to the vaccines. Now, it is true that the Delta variant has slightly increased its resistance to the vaccine, but the vaccines are so good, they are so good that they're still very, very, very effective against these variants. And the evidence, early evidence suggests that with this Omicron, the vaccines will still be effective too. And so anybody, I've heard people being pushing, if the vaccines are not protective, then what's the point of taking it? But the vaccines are 90+% protective. And because there's been a twist and misinformation to tell people the vaccines are not effective, they're zero effective, some people say, well, what's the point of me taking it? Well, you need to take it because they are very effective. They are the main line of protective. And I'm one who believes in what we call vaccination plus, so that you vaccinate plus you wear your mask, you wash your hands, you have the social distancing. So the answer to your question is that I know the Ministry of Health is promoting more and more people vaccinate. All the various clinics and so forth that are available with the vaccines, please go and get it. They're available to you. But in the meantime, in addition, plus on top of this, put on your mask. Try and keep it on as much as possible in public places. In your house, you don't have to do that. You know what I mean? If you're also in spaces where it's just vaccinated persons, then also, you know, some measure of comfort could also be taken too. But always tend to have your hand sanitizers, use as much as possible, and practice the high level of physical distancing if you can.
Okay, Doc, we'll take our first break and come back in just a moment.
Sure.
Hello and hi.
Hello everyone, I am Shakel Bob. I am a former Miss Pitani, a former Miss Rural SPG and Miss LCD contestant and runner-up. I'm a lawyer by profession, but a pageant lover at heart. Do not let the negatives prey on your mind, because a stitch in time saves 9. So, it's COVID vaccination time. Get vaccinated today to reduce the impact of COVID-19 in St. Vincent and the Grenadines.
And I urge you, get vaccinated. It is safe and it is effective. Stop the spread, help the fight, and make the choice that is right. And let us unite and do the thing right.
Welcome back. Doc, the early reports out of South Africa seem to suggest that the doctors are saying that the symptoms that they're seeing are quite mild. How do you respond to someone who is saying that, well, if the symptoms are mild, why the big deal? Why do we need to be concerned?
Well, on average, the symptoms may be mild, and I really hope that they are mild. Do you know that ordinarily, a number of persons who do catch COVID, they catch it with asymptomatic type conditions. A good 50, 60, 70% are either mild or asymptomatic to begin with. We're always worried about that 10, 15% who catch it and it's very severe. They are admitted to hospitals, intensive care units, they fill up intensive care units, the requirement for oxygen becomes very great, and between 1 and 2% may even die. So if something is going to be milder, that is just fatigue and a headache and a scratchy throat, then I think that's really great. But what it also means is that a lot of people may be moving around asymptomatic, and because of its increased transmissibility, we are always worried about the aged, the persons who are elderly, the diabetics, the hypertensive, the persons who are recovering from cancer, the renal failure patient, other HIV patients, arthritis. Those individuals should have already received their vaccine. But unfortunately, Mr. Grenadines, there are people with high blood pressure and diabetes asking us, should I get the vaccine? And we're saying, I hope this doesn't come across the wrong way. Yes, you should have been the first ones to get it. Please go and get it. People with heart disease, please get it. So the question will be, even though this Omicron, which is not here yet, if it does infect and it's mild, what sort of impact will it have on more severe, on the more critically ill, people with comorbidities? One thing they've also noticed affecting younger persons. It's affecting younger persons. And secondly, they are seeing signs of reinfection. People who may have been infected before, now catching it a second time, or maybe even a third, because of the increased transmissibility. Now, catching it a second time and a third doesn't mean that they'll end up in the hospital or that they will end up in the intensive care unit. But anybody catch it again, for a period of time, they could transmit it to someone else who themselves may not be able to withstand a new variant or any variant. And then in general, it may not be the Omicron or the Omicron that infects you. It may be a Delta or a Gamma, and you have to be prepared to that as well, because that could definitely end up in the intensive care unit.
Yes, I've had a friend from a neighboring country who said to me that he was infected twice, but he had no symptoms. In fact, he only knew that he was infected because he was a contact of a contact, something to that effect. Now, how does this happen? How can someone be infected twice? And is it the same variant that infects that particular person?
It could be a different variant. If you were infected last year with the Alpha variant out of England, this year you could be infected with the Gamma and the Delta, because they are more transmissible, they're more aggressive, they're much tougher, sterner variants. Yes, they can cause a secondary infection. Now, at the same time, to significantly reduce the chances of being infected at all, getting vaccinated reduces that possibility. Now, what happens sometimes, and what happens often, is that after 6 months, the amount of antibodies in your blood may start to wear off. It may start to wear off. And as a result, it may drop below the protective area. So when you got vaccinated, you've now got hundreds of millions of antibodies in your blood waiting, ready for the virus. And the virus comes along, it will take care of them. But 6 months later, the antibody levels could start to drop off, especially again, if you're diabetic, hypertensive, renal failure and so forth. And so therefore, getting the booster pumps you back up and gets your antibody levels back up to the hundreds of millions so that you are remaining protective rather than it falling below 100 million in just the tens of millions. Because when the virus comes along, the virus is also going to be producing tens of millions of viruses. So you want to know there's enough antibodies around to deal with the amount of virus that starts to get produced.
Okay, I know that other countries have an urgent push as far as boosters are concerned. I know that we have our own challenges with people taking the vaccine, period. So what are we saying to encourage those who have already taken the vaccine and impress upon their minds the need to have a booster, and what would that regimen entail? Is it a third shot, or is it a third and a fourth shot?
I would say the primary interest has always been the unvaccinated individual. We want them to vaccinate. But at the same time, the person who's already vaccinated, because they have been well protected for 6 months, we don't want them for the next 6 months for their antibody levels to drop. So we do encourage them to take the vaccine and a third dose and get pumped up. And you can mix and match. If you had the AstraZeneca before, you can get a Pfizer. And if you had the Sputnik before, you can also still get the Pfizer and so forth. I think currently there may be not a lot of AstraZeneca around. I don't think they have any. But the point that's being made is that it doesn't matter what you get really as the booster. Get the booster so that your antibodies levels can be pumped back up to the hundreds of millions of antibodies so you're fully protected and that your levels haven't shot. Whether there will be a need for a fourth dose, I believe that looking at how the pandemic is run, there are countries of the world, like in Africa, are complaining that because everyone's focused on getting boosters, there's no vaccine available for them. And so there's an issue. Do you try and vaccinate poor folks in Africa and countries that will be the source of new variants coming out? Or do you focus on vaccinating your own? Well, I think you got to do both. And somehow or the other, we do have an obligation to try and protect people. It's strange, that I think this government has not paid a single cent of taxpayers' money to get vaccines. They've all been donated, but we've had vaccines available. And it's a shame that sometimes we've had to give away, which is a good thing, and that sometimes persons may not want to use it. And I'm hoping there will not come a time when vaccines are not available to us. But right now, since the booster is available, take it. Take that booster now. If you've had your second vaccination over 6 months ago, get your booster now. I got a booster and I'm all right.
So did I. What is our vaccine pool looking like at the moment? Do we have enough adequate supply for everybody who wants?
I must applaud the US government made a significant donation to CARICOM. And we got our first tranche, and I believe that they had offered us a second tranche, and we weren't quite ready for it. So I think that there may be now a process where we should be able to get our second tranche of that Pfizer vaccine. There doesn't seem to be a need for the Johnson & Johnson or the Moderna. The Pfizer is one of the most highly studied vaccines. And even though it falls off a little at 6 months, and I must say, it's my view that the AstraZeneca and the Sputnik, the antibodies last a little longer. But the Pfizer is a really good vaccine, well studied, and you'll continue to hear a lot more about the Pfizer vaccine from every quarters of the world.
Okay, so there's a question here for you. South Africa's government is beside itself. The government said if poorest countries are not protected, it poses a problem for the richest countries of the world because of travel. Do you believe that's the case?
There's some basis for that, but no, I think that St. Vincent has always had an approach that visitors coming in should come in with a negative test, and they could be tested at the airport and placed under quarantine. We have reinstituted that program, or at least the government and the Ministry of Health has reinstituted that program for these extremely high countries. We have not restricted persons from coming in. You understand? We've not restricted persons from coming in. They have to go through those protocols, but some countries have stopped flights altogether coming from South Africa, but that's their choice, and maybe it's their sovereign right to be able to do so.
We'll take a second break and come right back.
My name is Ruth Stevens, and I'm the owner of Hotel Alexandrina. Currently, most of the hotels are empty. The cruise ship berth is vacant. The airport almost shut down. And we as Vincentians cannot get back to the new normal until most of the Vincentians take the vaccination. We want to improve our economy, and the only way we can do that is to get Vincentians to take the vaccine. I have taken it and I'm fine.
And do not procrastinate, but rather let us vaccinate. Hi.
Welcome back. Today, as we mentioned earlier, is in fact being observed as World AIDS Day, the theme of which is End Inequalities, End AIDS. In a sense, would you say that the COVID-19 pandemic has eclipsed the HIV/AIDS situation in St. Vincent and the Grenadines?
Now, I want to tell you today, World AIDS, they bring back a lot of memories. I was trained as an infectious disease specialist in 1987 to 89. 1988 was the first International or World AIDS Day. And I remember I had made a presentation in Chicago on the area of my study, HIV in the elderly. And I had 60 patients over the age of 60 who had HIV for various reasons, and this was one of my publications. As a matter of fact, what is interesting is that I was on the team of the first case of HIV-2. HIV-2. Everybody may think there's only one HIV, there's HIV-2. It's milder, and there are many, many strains and variants of the HIV. We classify them, the HIV 1, A, B, C, D, F, G, different groups and so forth. And it alarms me that now today, 53% of the cases in the world are in Africa. I know you've asked me the question about St. Vincent and the Grenadines, but in 1987, 88, 80% of people died from HIV, 80%. By 2000 and the year 2000, it had dropped to some 13%. I am so happy in 2010 when it dropped to 9%. And today, HIV AIDS, the death rate is just 3%. And you have a situation where because of drugs, different medications, people are living with AIDS and the HIV is undetectable. There's been a very good program here in St. Vincent. Various doctors, I know Dr. Davey and so forth, they've been doing marvelous things with our HIV patients, and the medications available, they're able to live normal lives if they come forward, are tested, and they're picked up, and if they follow protocols and so. So I know the HIV patients are getting on with their lives. They are at higher risk with respect to COVID, but HIV has now gone on for 40 years. And sadly, a lot of people have forgotten a lot of the protective protocols and so forth that sometimes come into place. But I'm worried more about Africa, South Africa in particular. And it is my hope that as this World AIDS Day, that we remember these, we continue to show love, and we don't look at it from what I brought. I hope that doesn't come out that HIV patients may be the source by which variants can emerge. There are other conditions, but I believe that they're one of the high-risk groups, and persons there should be vaccinated. But most of these individuals are also being treated. And the worst thing today is catching COVID if you are HIV untreated patient. If you're HIV and you're treated, then I want to say that you're receiving medications, then your white blood cells, your T cells have bounced back up. And those T cells will help to provide some protection against the COVID itself. But they're also protecting some protection too against the HIV. And HIV persons today are living normal lives, working in normal jobs, and they are taking their medications and doing well.
What similarities would you say exist between the COVID-19 pandemic and the HIV/AIDS pandemic?
I could tell you when HIV started out in the 80s, there was lots of scorn. People were saying it was just Haitians, hemophiliacs, and heroin IV drug abusers. They didn't realize it was going to end up going into the heterosexual community. I remember attending a conference in Newark, New Jersey. They had about 400 bishops and priests and so forth there. And you would believe this. Fauci was there and asking the priests to please help educate the Black community. But I remember one bishop got up and said, "We're sorry we cannot help, because any promotion of condoms would mean that we might be fostering and encouraging fornication and adultery." And I remember trying to go around hand out condoms, and people were saying I'm an Uncle Tom. What I'm saying is that there was a denial. And you would not believe this. In South Africa, after Nelson Mandela left office, the new president, Mbeki. Well, what if we could go to the break? Can we go to a break? My battery's about to go. Let me just try and go.
Welcome back. Well, Doc, I'm sure you're all you've regrouped and all juiced up and so on and ready to go and continue that point.
I had to find a plug to put in my battery. My apologies there.
Problem.
But I was raising the issue that after Nelson Mandela left, he had done such a marvelous job about vaccination, taking polio out of Africa. But when a new president came in, Mbeki, there was denial that HIV actually existed. And for many years, they ignored it. And that's how South Africa obtained that dubious distinction of having the highest HIV in the world. Now, for the Caribbean, as I said, I think that there is a really good regional program in St. Vincent and the Grenadines in particular. It's important that the individuals involved, especially those involved in HIV, the patients themselves, that there's unity, that they're able to come together and stand up for themselves and so forth. But I'm really pleased that today, HIV is a disease that is no longer a death sentence. I remember CP wrote that song about HIV. Well, it's no longer a death sentence, and people can live very normal lives, but they also have to be also very responsible that about their relationships and so forth, their diet, what they're eating, and to get access to their medication. Medications can sometimes develop resistance, but the parallel, I would say, is that there was initially a lot of denial and rumors and misinformation about HIV. And today, we are seeing the same thing with COVID, misinformation, the evil spirits in the vaccine, that Bill Gates is paying governments, that vaccinated people are spitting off spike proteins. But the most important misinformation is that the vaccines don't protect you. They are 90% protective. And that's what I wanted to sum up that with.
Can the COVID-19 response be informed by the AIDS crisis in any way?
I think that these sort of very social diseases, HIV was a very sexually transmissible disease. It helps us in one respect. There are people today saying people should try and catch COVID naturally. Catch COVID naturally. There was a year ago, in 2020, October, some scientists who called it the Great Barrington Declaration. Great Barrington is stupid. They said vaccinate the elderly over 65, but everybody else who's younger than 65, just come together, hug up, you know, shake hands, enjoy yourself, you know, and catch COVID naturally because you'll be protected. And there's some people today in St. Vincent who are pushing that. But catching COVID naturally can lead to death. It could also lead to hospitalization, overwhelming of your healthcare system. But it could also lead to something called long COVID. There are 2 million people in England living with long COVID. And there are people living in St. Vincent with sexual problems, erectile dysfunction, problems of shortness of breath, loss of taste, loss of smell, all sorts of different problems. And please, in the same way you wouldn't go out and catch HIV naturally, I would not want person to go out and catch dengue naturally or to go and catch COVID naturally, because there's no virus that you should be catching naturally and say, I want to catch this because I'm going to be now naturally protected.
So before we go, we want to talk about the dengue situation in St. Vincent and the Grenadines. Seems as though there are still quite a few cases emerging. What's the situation and what is being done to address this?
Well, dengue over the last 20 years have been trending towards some new concepts of having a more severe dengue. The reason why is that if you have been exposed to one of the 4 or 5 strains of dengue before, being exposed to a second strain, guess what? It could make it more severe. You are immune to the first strain you're exposed to, but the second one, the antibodies that you naturally develop can cause some serious problems and put you into shock, into various forms of shock, where your organs fail, your body starts to bleed and so forth. It's a horrible disease, severe dengue. But funny enough, Zika and dengue are like sisters and brothers. There's 40% of similarity between Zika and dengue. We had Zika in 2016. And so the current outbreak of dengue, it's largely, we having severe cases sometimes because people were exposed to Zika in 2016. Now, to sum this up, dengue runs in 2-year cycles. Last year was the big year. Brazil had 500,000 people who died from dengue. Martinique, Guadeloupe, St. Martin had huge numbers of cases. And this year, Barbados and Antigua have had more cases than St. Vincent. But it runs in 2-year cycles. One of the things is that the mosquito egg can last for up to 1 year. When the mosquito lays its egg, the mosquito that's going to come out of that egg can come out already infected with dengue. So it's ready to bite. And when it bites, it can transmit the dengue virus to some people. And if they once again have been exposed to different things before, Zika and so forth, and this as a certain type of strain, it can cause severe dengue. I believe that the Ministry of Health has done a marvelous job with fogging. And I would have hoped there would have been no cases. It's very unfortunate that Sir James and several other persons have had to succumb to this particular virus. But I believe that there's been, at the same time, coming out of La Soufrière, we had thousands of barrels and water bottles coming into the country. And I want to encourage persons, if you are recycling, you know, make sure those water bottles are not left out there. They will breed mosquitoes. And secondly, in terms of your drums, try and cover your drums that people sent in for La Soufrière with goods and so forth. So, you know, we will tend to have dengue in 2-year cycles. This is the 2nd year, and we have to just get through it. I'm hoping that hopefully by January we'll be over with dengue as we go into the dry season.
When does it really get intense to the point where people succumb to dengue?
Well, you know, we've been having a few cases. It's true, it's a rainy season phenomena. And when the dry season comes by, then you find that the cases slacken off significantly. You know, they will slacken off. And I'm hoping that 2022, there'll be hardly any cases of dengue. But when you find yourself having a high fever, okay, it may be COVID, it may be the flu, maybe something else, but don't take it lightly. I think the Ministry of Health last year had promoted the use of papaya leaf juice. The pharmacies had actually mixed it up when it was very intense. It works, actually, but there's nothing wrong, and I want to promote seeing your doctor, this is going to be, and getting good advice and so forth, how you, we want to make sure that it's not severe dengue and that you don't go into shock and start to bleed, because bleeding is one of the big problems, or organ failure as a result of shock. And so we have to pick that up very early. And the first sign is that of sometimes fever, headache. But the headaches that you have is what we call headaches in the back of your eye. So today, if you tell a doctor, Dr. Boy, I have real headaches in the back of my eye, something called retroorbital headaches, he is going to do a dengue test on you straight away. And if you start having vomiting, that is another big sign for dengue. So fever, headaches, retroorbital headaches, pain in the back of your eyes, as well as nausea, vomiting, something abdominal pain. These are some of the early signs that we have to look for.
Okay, so then the important thing here is to be able to distinguish between the severe and the not so severe form of dengue.
You know, you let the doctors do that. What we want to do these days, anybody having fever, could it be COVID? We may be going into the flu season soon. Could it be something else? Could it be dengue? I know there seems to be so much viruses all about, you know, and we're talking about HIV. You know, people must be getting very discouraged with hearing about all these viruses. But some of these viruses have been around for a long, long time. Dengue has been around for many, many, many years. Used to cause a lot more problems in the past, you know. But today, we are seeing a resurgence of dengue. And now with COVID, it's hard to make a distinction. Any fever that somebody's having needs to be checked out properly. Don't leave it. Any health problems, don't disregard it. Everything now, people, and definitely people have to eat well, drink lots of fluids, you know, take vitamins, and, you know, they won't protect you from everything. They'll help as supplements, but the important thing is watch your health. Watch your health very carefully.
Okay, the COVID and dengue do mimic each other somewhat.
The only, COVID tends to cause a mild fever. Dengue surprisingly causes a high fever, a fever of 102, 103. And once again, it gives you headaches and pain in the back of your eye. Now, I hope this Omicron doesn't come here, because they're saying one of the signs of the Omicron in its milder state is fatigue and headaches, you know? So it's going to be tough for doctors to distinguish. But luckily, we have lots of tests now. And they'll be able to do tests, and within a matter of a couple of hours, they'll be able to tell if it's dengue, if it's COVID, if it's this or that.
Okay, Doc, quickly before you go, a news release out today talking about some concern the Ministry of Health has with regards to hand, foot, and mouth disease. Tell us what's the situation and what's going on here, and what is being done, etc.
Well, let me say, they're seeing, surprisingly, around the world, as the pandemic eases off in many countries, that this hand, foot, and mouth disease is making a little resurgence. It's something that is actually not uncommon. It happens a little bit more in daycare facilities, nurseries, daycare facilities, where people are changing diapers, and kids, even though you're changing diapers, they may put their hands and then they put their hands in their mouth and so forth. It's caused by a virus called a Coxsackie virus, a couple of other things like that. It may cause a little rash and some blisters in the hands or the feet and so. Sometimes there can be some more severe cases, but we tend to see this every year, a few mild cases. And I think as we are that much more vigilant now, anything that affects our kids, anything that affects everybody will rise to the top of being examined. I think the Ministry of Health is right to alert, bring out an alert on this particular issue. I think that over the next few days, you'll be hearing much more about this. Usually washing hands, as we've been doing, for COVID, we should be washing a lot of hands and hand sanitizers, and the kids should be washing hands. In my view, there's no reason to stop schools and so forth or anything of that nature. In daycare facilities and nurseries and those sort of facilities, extra care should be taken for washing hands and making sure that mouths are covered and so forth. Because it's not so much about getting into your lungs and your respiratory tract, it's more getting into your mouth that is. That's why we say hand, foot, and mouth. Blisters in the hand, blisters in your hand, in your feet, in your hand, and also hand, foot, and mouth in terms of other oral and intestinal problems. You'll be hearing a lot more about it from the Ministry of Health and the pediatrics, but I'm hoping that this is just a passing wind and that it will go away and we focus on the main things that are happening, that being COVID-19 and whether or how we can avoid the Omicron, and more importantly, how people can become vaccinated. These vaccines protect you. Don't believe the hype that vaccines don't protect you at all or zero protection. They're great. They're protecting you up to 90%. It's just that there are some persons who are not fully protected because they're diabetic, hypertensive, renal failure, HIV, and so forth. And they definitely need a booster very early. And if you need a booster too, they're available. You should go and get your booster now.
Thank you so very much, Doc. Great of you to join us again this evening. I know that you have some challenges that you are facing right now. Thank you for your expertise as always. That's our program for today. So glad you could join us. Tune in again next week, Wednesday at the same time for another edition of Roundtable Talk. Until then, good evening.